My name's Tor Morkenberg, and welcome to the St. John's Family Medicine Residency Program. One of the big reasons I chose St. John's was because of the location. So we're a small, tight-knit program with 6 residents per class, and our hospital, St. John's, is located in the suburb of Maplewood, Minnesota, just north of St. Paul. Our clinic is Phelan Village, and that's located on the east side of St. Paul itself. St. John's is a medium-sized, community-based, unopposed hospital with lots of good learning opportunities and attendings who love to teach. Phelan Village is an urban clinic that's a pillar of the Payne-Phelan neighborhood, where we see a diverse range of ages and backgrounds.
I chose St. John's because we get full-spectrum family medicine training in a large city. From inpatient and OB and newborn nursery, we also get to pursue our own passions, which can include sports medicine, procedures, women's health, all while serving an underserved population.
I chose St. John's because of the strong inpatient training that we get here. We have 2 months per academic year where we are on the inpatient service, and then we also have a queue-based call schedule, so we are in the hospital multiple times a month taking admissions and taking cross cover, and this just gives us a ton of learning opportunities, a ton of interactions with patients and seeing different conditions, and ultimately helping us develop into great doctors.
One thing that's really unique about St. John's is that they encourage us to have autonomy really early on with your first rotation in the inpatient realm. With that, they encourage you to create your own plan and act out your own plan with patients. One way that this is facilitated is with one-on-one staffing with the attending. So each day I take on a patient, I come up with a plan, and then sit down and staff one-on-one, really getting that time to sit down with an attending and work through my plans and think through critically each medical problem that these medically complex patients have, really preparing me for whatever life throws at me down the road as a full spectrum family medicine provider.
One of the reasons I chose this program was because of the strong OB training. During our first year, we have 2 months dedicated to labor and delivery, and we get to work with some fantastic OB as well as community family medicine physicians. During that time, our residents typically get about 20 deliveries, vaginal deliveries each month. We also get to first assist with C-sections during that time, and we do have the option to pursue credentialing in C-sections if that's something you're interested in. And then as second and third years, we continue to have a lot of great OB experiences. We get to help manage our continuity deliveries, which are the people we see in clinic from kind of positive pregnancy test until they deliver. And then while we're on call, we get to help manage all of the undoctored patients who present to labor and delivery, and then also kind of take a swing at all of the labor and delivery triages.
One of the many reasons why I chose St. John's was for its robust outpatient clinical experience. As a current third year, my clinic days are packed with really diverse, different types of patient experiences. I'll see patients with chronic diseases like diabetes, COPD, hypertension. Then I'll go into doing preventative care visits for adults, well child exams for children, prenatal care, and then adding in a bunch of different office-based procedures, things like IUDs, Nexplanons, casting, splinting, colposcopies, all within the same day.
One of the things I like about our program is how we do education. To give you some basics, we have 2 to 3 didactic sessions per month, and those are usually ran by either specialists in the community, faculty, and or our own residents. And then we also have noon conferences that run during the lunch hour, and those again are from the same people, specialists in the community, residents, and faculty who drive those.
I chose St. John's because of the community involvement of the program. So as a second year, I was able to work at WIC during my community health month. I was also able to volunteer for sideline coverage of the Johnson High School football team, which is close to our clinic in the neighborhood.
So I'm interested in leadership and advocacy, and St. John's has allowed me to pursue those avenues. via two means. Along with Joe, we created the anti-racism curriculum, where we're looking into developing our curriculum to reflect sort of the events following the George Floyd death, and also to improve advocacy within our clinic.
Yeah, and I was able to participate in a group called the Residents as Advocates cohort, and basically it was a year-long longitudinal program where we did everything from creating a Twitter all the way to meeting with legislators towards the end of the year, and so long-term longitudinal advocacy is very much a part of our program.
I chose this program because of the folks that work here. You know, I feel like during interview season we're talked to so much about how robust a program's OB training is, or about how the inpatient medicine months make us well equipped to treat any patient that comes in front of us. But ultimately, what mattered the most to me was finding a program that made me feel at home, and somewhere where the residents enjoyed spending time with each other. And I feel like a good measure of that was seeing how residents interacted with each other outside of the hospital, or if they spent time with each other outside of the hospital. And as a med student here, I was included in 2 or 3 gatherings outside of the hospital in just my 2 weeks here. You know, whether it was getting drinks after didactics, or going to a party at one of the residents' houses. And it just created this community feel that I felt from day one, and I knew this is where I wanted to be.